So thank you very much. Welcome back. I hope you enjoy the networking corner that we have outside. You discover more about our projects and initiatives related to research RI. And now we are going to start with the last session of today's meeting with a high-level panel of experts. And the topic is about evaluation of the ETHNA system, what to extend and not to in the ethical implementation processes and practical guidelines. Here in the round table, it is with me Gabor Szüdi, Center for Social Innovation, Marko Hajdinjak, Applied Research and Communication Fund, Maya Vestergaard, the Danish Board of Technology, and my colleague Ramon Vestergaard will moderate the table. At the end, you will have 10 minutes for questions. Then we will try also to finish a little bit earlier, so you will have time to move to the next step we have today. Okay, thank you very much.
Thanks a lot, Anna. Thanks for staying here with us in the siesta time. Well, we had in the first part of the morning a more conceptual presentation of what ETHNA means. We had the stakeholder engagement as well session later, and in the last part we saw the presentation of the implementer. So we thought it makes sense now to listen to different evaluation processes that have been happening during the ETHNA system, and we have here the three experts that have been doing this evaluation on the ETHNA system. They have been assessing and evaluating different parts of the ETHNA system. They will explain it now. There will be some presentations, but there was some engagement with the public. So we really hope to listen as well some of your opinions and voices. But now let's start and see how it goes with this last session. Thanks a lot for being here.
Yeah, so I want to add to this that we have changed the order a bit. So we will have some interactive elements and discussions in between presentations, so not only at the end. First, we want to just give you an overview of the timeline of the ETHNA system evaluation process. Then I will talk a bit about the implementation challenges and opportunities. Then we will have Marko talking about recommendations for the future uses of the ETHNA system. And then finally, Gabor saying something about the implementation factors for different types of organizations. So before beginning on the presentations of the evaluations, I want to change the slide. Gabor, would you tell us a bit about the timeline for the evaluation process?
Okay, so this is, I think, something which is important from the get-go, that we are talking about the evaluation, but we have been involved in different parts of the evaluation. So Maya and DBT was responsible for the living labs, Marko was responsible for after the living labs, but our organization, the Center for Social Innovation, was responsible for bringing together all the results of the evaluation. And which might not be first, I think, understandable, if you are listening to all this presentation, but I think this is something very important, that this process was ongoing from the get-go, from the beginning of the project. So you can see on this slide that it started already, I have to get it back, in early 2021. Because before the living labs, under the guidance of our organization, the Center for Social Innovation, we started with a questionnaire, which was intended for the internal partners, for the implementing organizations, so all of them whose experiences you could hear already in the morning session. And this was followed up, which was also mentioned by Elsa and other people, by a multi-stakeholder consultation, where we had three main parts of it. First, we had workshops, which were around the different RRI keys. And also we had interviews, more than, I think, 25, more than 20 interviews we have made with more partners in more countries to get their opinions about the most important challenges, barriers, opportunities, and also good practices that can help us to make really a successful RRI institutionalization process. And afterwards, and this was already like almost 1 year later, at the end of 2021, we have conducted a global survey with my colleague Dietmar Lampert, who is sitting there in the audience, and it was, I think, a quite successful survey. We have gotten almost 1,000 answers, and this really helped us to put into perspective and what are those potential challenges and potential factors that can hinder this implementation process, and what are those factors that can help us. And we brought, I hope, successfully brought this knowledge to the Living Lab implementation, which was running then afterwards from the end of 2021 until the end of 2022. After which, again, there was an evaluation process going on, and this was done on the one hand by DBT and the other hand by ARC Fund, and consisted of a series of workshops done with internal partners, Living Lab implementers, but other related internal partners in the project, and also external partners. And then ARC Fund made a questionnaire, quite similar like at the beginning for the Living Lab managers. And all this evaluation effort came together at a physical meeting. Thankfully, we could meet face to face, I think, after more than 2 years because of the disruption caused by the COVID-19 virus. Last year in October in Sofia, we brought it together, and that was, so to say, an end of a very long process, which was all intended to make us the best possible ETHNA System concept guide, which was presented by ELSA. So when we are talking about this ETHNA System concept, that it's not something that we have just so invented, but it's really based on the opinion of many people from many different disciplines from many countries. And that's why I'm really hoping that we manage to do a guide which is really useful, because it's really based upon these different perspectives all around Europe. So that's it, I think, that must have been said at the beginning, and I give the floor back now to Maya.
Thank you. Then I will say something about the implementation challenges and opportunities. DBT was responsible for conducting some evaluation workshops about the ETHNA system and the Living Lab implementation process. We had workshops both with implementing partners, with internal stakeholders and external stakeholders. And now I want to share with you some of the challenges and opportunities that were shared with us from the implementers and internal stakeholders' perspective. But before presenting you the challenges first, for the implementers and internal stakeholders, we want to ask you about your experience with implementation challenges connected to working with ethical governance. So I know some of you are implementers and have experienced these in connection with the ETHNA system. Some of the others have maybe worked with implementing ethical governance structures more generally, and may also have some experiences they want to share. So let's see if it's working this time. This time it's not Mentimeter, it's Slido. So I would ask you to go to slido.com and then enter the code that you see here on the slide. And then hopefully we can see your answers. And you can answer multiple times. So. Oh, sorry. Okay, have you put in your answers, or you still need some time? Some time, yeah. Okay. Yeah, you have completed? Okay. So let's see the answers that we have gotten. So it seems that the two most frequent experiences is a lack of resources, including human, financial, and time-wise. Then it's also quite common to have a lack of staff members responsible for ensuring implementation of ethical governance structures. And the senior researchers resisting to change, which we also heard about several times in the presentations given earlier by implementing partners. We have a lack of dissemination structures to effectively circulate ethical governance. And also less important is the ethical governance structures are too top-down. Okay, so thank you for your answers, and we will move on to telling you a bit about the implementation challenges as they were experienced first by the implementing partners. So we have made three overall themes based on the implementation challenges brought forward by the implementing partners. And one of the themes was centered around implementation method. Then we had a theme about institutional reluctance and resistance, which we have also has been mentioned several times today also. And then finally, there was a theme about internal consortium restraints. And the first challenge here on the slide has to do with the implementation method. And it says that the implementation methodology was too rigid. And I've brought a quote to exemplify the statements for each of the challenges. And the first one here says that the biggest challenge was to follow the steps and in the period that ETHNA needs us to do it. And at the same time, for our institution has its own timeline. We had to skip some steps and change some procedures in order to attain the same goal. This was one of the challenges that were generally reported by implementing partners, which led to changing or skipping steps, as also mentioned. I might also add that, of course, there are these different implementing contexts. So the challenges mentioned here are not the same for all institutions, but this one mentioned here was something that was generally reported. The second one is that it was difficult to engage external stakeholders, and this was especially true for small organizations. And the quote here says that stakeholders do not have time, or it is too difficult to explain RI concepts for someone who is not related to the area. The third challenge here has to do with the second theme on institutional resistance, and it's about senior researchers resisting to change. And this was also, as we have heard today, something that has been reported several times and also led to some creative adaptations. And the quote here says that it was not easy to change the culture at work, so we have put more emphasis in training junior staff. The fourth challenge that I want to mention is that it was difficult to adapt the ETHNA system to existing structures. And here, it's brought forward that it was really dependent on the institutional context and preconditions in the institution. So this was one of the institutions having difficulties adapted it to their existing structures. And the quote says that at our department in NTNU, ETHNA is doubling up structures that are already in place. It is another top-down measure, and what is needed is another better utilization of existing structures. We have detected one ethical issue regarding gender imbalance, but structures are already in place. The issue is to make use of them. The next challenge says that it was a challenge to implement in a small organization because of a lack of resources. So this was also mentioned by you before, that this was one of the most important challenges in implementing these ethical governance structures, and it's not only financially, it can also be human or time-wise. And the quote here says that same members have been involved in RI-based projects over the last 5 years, so there is a kind of RI fatigue and a lack of enthusiasm. The other half of the team is difficult to engage in these topics as they have limited time for their own tasks. And then finally, for the implementing partners, it was a challenge for some that piloting is a learning process and it takes time to learn the jargon. And I will touch upon this theme about internal consortium restraints, and it was also mentioned in the discussion among implementing partners earlier today, that it can be quite hard to get into this jargon of the project if you're not familiar with the scientific area. So the quote says that I would expect our experienced partners to understand that sometimes even basic things need to be repeated. I would also like to feel that what we are doing is not a routine activity, but that we are contributing something new to this specific project. And then I just want to move on to highlight a few of the challenges that were mentioned by the internal stakeholders. And the first two ones is also about this institutional reluctance, the one about senior management resisting to change. And the quote here says that there were difficulties in negotiating with the senior management, although they know now more about ethics following our meetings. They still try to convince us that their old code is good enough and no change is needed. And then for the junior researchers, they resist in incorporating the code as their life becomes more complicated, for instance, more work to do. But as was also mentioned, it was also brought forward by the internal stakeholders that trying to introduce this ethical governance early for the young researchers might also be a way forward, even though they are a bit reluctant. And then the last challenge is that there was a lack of awareness and circulation of the ethics codes and document, which really highlights the institutional efforts needed in this dissemination for it to be effective. Yeah, and the quote says that dissemination needs to be improved, documents needs to be visible to all researchers and staff alike, clearly stating what is expected by them and the institution as a whole. And then finally, I want to share with you some of the opportunities that the ETHNA system also provided for the implementing partners. And the first one is that there was an increased awareness of ethical issues, and this came from talking to colleagues throughout the implementation process. Then the ETHNA system was also a good training material for a PhD student. It was used in a study program on ethics. It also helped visibility and expanding network, and this was from engaging in discussions with research councils, research funding organizations, and ministries throughout the process. Also, guidelines on open access have gained traction. It helped researchers in selecting channels where to publish. The ETHNA system also led to update and development of ethical codes and institutional practices. It served like as a well-structured, practical way to update and develop these ethics codes. Then it was an opportunity to be compliant and in line with the European regulations and ethical recommendations. And finally, there was also some enthusiasm from researchers who came up with initiatives and practical ideas. So to wrap up this presentation here, we want to ask you to, in a minute, discuss with some of the people sitting next to you, and perhaps if you are sitting very far from some other people, you can just try to move closer to someone. And perhaps a few of you want to share afterwards what you have discussed. So the question is, what is the most surprising and what is the most important implementation challenge in your opinion? And I think you can have like a few minutes to discuss.
Hola.
Okay, so I'll interrupt you now. Please wrap up your conversations and come back to the stage.
Hello.
Okay. Thank you. Okay, so we are starting again. Yeah. Okay, nice to get your attention again. It's good to hear that you were engaged in very active discussions, so thank you for that. I would just, before giving the word to Marko, hear if any of you want to share some of the things that you talked about, either some of the most surprising or most important implementation challenges. Comments are welcome, or questions.
We were talking about the different. I mean, most people actually want to do responsible research, but they don't like the top-down. Yeah, and as soon as the people resist, of course, it's very difficult to, do something. So we talked about that most of the time.
Thank you for that comment. Does it resonate with the others? Did you have similar discussions? No?
Hi. Well, in our case, we were discussing a bit about the reluctancy of both the senior staff, but also the junior staff, no? And we had we had different perspectives of why this is going on. So this is why one of the things that we were discussing mainly. Thank you.
Thank you. I think it sounds interesting that you had different perspectives. Would you want to share these differences?
So yeah, being a senior researcher myself and knowing the burdens that they share, I would have expected resistance from senior researchers more than junior researchers. And also, at least when I studied, ethics was a course that was being taught, and also growing up, quote unquote, with open science, that was a logical extension, actually, the concept of RI. So for me, that was a given. But apparently that's not the case, or also not the case in every country. And also, we were discussing where best to, put on the lever to reduce this resistance in young researchers. And apparently there are different requirements by different curricula in countries. So that's where we stopped, and we would have liked to have more time for discussion, but I understand you need to move on. Okay.
All right, thank you for that clarification. Any last comments or, yeah?
We think the most important and probably difficult part is an implementation across all institutions in Europe that is similar, not too different, because if one institution do it very well and the other ones doesn't do many, it's not going to work. So we have to think how the implementation can be similar across all the institutions.
All right, thank you also for your comment. Yeah, if there are no more comments or questions, I will pass on the word to Marko.
Okay, thank you. I'll stand here so I can look both ways like a chameleon. I'm going to present the findings from the evaluation we did about the implementation process in the 6 piloting organizations. One disclaimer before I start. This is the path of the implementation. So we started, we ended, and then we did the evaluation, which means that I can only present the results of the evaluation of the implementation process, but not of the results. As you can see, the results are hidden somewhere beyond the horizon. In most cases, as you have seen from the presentations before the launch, we have not really gotten there. The results are still ahead of us because all the things we have constructed, we have put in place during the implementation still have to start operating, to ethics committees, they have to start operating, to receive signals, complaints, notifications, to respond to them. The ethics line has to start operating and working. The RRI officer has to get used to the new job and to start communicating with other stakeholders in the organization, etc. So the evaluation of the process, not of the results. One of the things which, some of the findings which emerged out of our evaluation is that all the organizations that plan to implement ETHNA Office need to have certain preconditions. They need to fulfill certain requirements. Before getting on with the implementation, it's essential to do a review or analysis of the internal resources. What you have in terms of departments, programs, units, person responsible for RRI concept or any of the 4 RRI keys, what is the state of the internal documents, what is written in them, what is already covered, what can be changed, updated, or added to. So before you conduct an analysis, you cannot really start with anything. Then commitment of the management, of the leadership of the organization. If the big boss is not on board and does not agree with the process, well, there's nothing to be done, actually. You have to convince, well, this is the chicken-egg question. Is somebody who wants to implement ETHNA Office, does this person should go to the boss and convince him that this is good for the organization, or the idea has to come from the director, from the leadership, and then to appoint the person responsible for implementing it? I don't think we can really answer. Well, Luis definitely has a good experience and knows that this is the way to go, but in other cases, at UHI, you had developed the whole project to then convince the leadership of the university that this is a good approach. In other cases, we got involved in the projects. We also had the agenda, but for the future implementers, this is really a crucial question, how to actually kick off the whole process. Next come the resources. Some of these will emerge during the analysis, but in order to implement the ETHNA Office, you need people, you need working group, you need coordinator of the implementation process to actually perform the whole thing and introduce the ETHNA Office with all its structures in the organization. And this is by no means an easy task. You don't need only people, you also need financial resources. This is the implementing ETHNA Office is basically a full-time job. You need a committed person who can do this 24 hours, well, okay, 8 hours a day, every day. But you need to pay him or her. So in order to have such a full-time position, you need a budget that allows it. If you don't have the budget, then you have to rely on somebody who is really dedicated to the idea and willing to do this voluntarily, but along with other obligations we have as researchers, administrators, whatever, this is another tough nut to crack. So then, like I said, implementation coordinator is the essential person in the process, but it cannot be only on the shoulders of one person. The implementation coordinator also needs a team. Like Laura mentioned earlier today, somebody who is responsible for gender issues, somebody who is good in ethics, somebody who knows how to do the public engagement, etc. You need a whole team. Then the next thing, in larger organizations, sometimes it's feasible to actually start with implementation in a smaller unit. For example, a faculty of a university or a department within a research organization, and to build from there. But this means that you need very effective and permanent communication between the different levels of the organization, between different programs, etc. It was also mentioned several times earlier today about co-creation process. So colleagues, employees, researchers, management, they have to be actively involved in the process. External incentives are important, especially the requirements from the funding agency or from the government. This can be important incentive which keeps the process on track and brings another dimension, another feeling of, you know, we have to do this, which is a good motivator. So yeah. What are the recommendations we can give to potential future implementers of ETHNA System based on our experience? Like I said, co-creation process is essential. Co-creation can take many different forms. Co-creation can be applied during the analytical process in the beginning. You do interviews with your colleagues, you conduct focus groups, workshops in which you try to gather information about what already is available in the organization, what needs to be done, what needs to be changed. Then there are debates, surveys, feedback exercises, which will help you to update the resources you have constructed and to review them and keep on changing them until you get to the best possible outcome. Another important lesson from our experience is to plan realistically. You need to be modest and to the earth about what are the objectives that can be and need to be achieved in the organization. Keep in mind that the implementation is a very slow and time-consuming and resource-consuming process as well. In all our 6 organizations, we found out that 1 year is definitely not enough to implement the whole structure. And actually, this is why we also developed a 5-year ETHNA System sustainability plan in which we recommend to spread out the process which we conducted within 1 year to 5 years. First year to do the pre-implementation analysis, 2 years to do the proper implementation, and then 2 years for monitoring, evaluation, and review. Organizations and those within the organizations who are preparing the implementation plan should focus on what is important for the context of the organization. ETHNA System is a very flexible ethics governance structure which can allow for different elements to be combined, so we can always select and assemble what is really relevant for your context using different combinations of the building blocks. If you already have code of ethics, ethics committee, or other elements of ETHNA System in place, of course there is no need to reinvent the wheel. But ETHNA Office is an excellent opportunity to look at the existing resources, rethink them, and if needed, update, reform, and reinvigorate them. This was also mentioned several times in the morning. Approval does not equal engagement and participation. So if you have a lot of thumbs up and a lot of applauding, that's an excellent idea, yeah, go ahead. And this doesn't mean that there's going to be a whole bunch of people who will want to contribute to the implementing effort, especially not voluntarily. So again, go back to the careful planning, be modest with the activities and goals you want to achieve, and very carefully count who and what are the resources you can include in this process. And finally, don't get frustrated if you conduct the whole implementation, put everything in place, and then there are no results inside. The results of this kind of ethics government structure will only be visible in 1, 2, or 3 years when all these structures actually start operating and they become a normal modus operandi of your organization. And now, one question for all of you. Are you by now confident that you could implement the ETHNA system in your organization, or would you need additional help and guidance? Need more time, or are we done? Just wondering if you can raise the hand. Who answered? Who is not implementer, one of the 6 piloting organizations, and answered confident? Okay. For those who are not sure yet or need additional help, let me just briefly mention again the 5-year ETHNA System Sustainability Plan, which was published 2 months ago. And by the end of this month, there will also be a manual for implementation coordinators available. So this is the additional help we can offer. Otherwise, get back to us, and we'll try to provide guidance and advice.
Okay, so I will continue also from here, otherwise I would have difficulties. I have the uninviable position that I am the last presenter. So I'm going to be honest with you. Everything already has been said. What I will do now in the next 15 minutes, I think I will put into some other perspective what we have been saying through a framework that we have developed, because we had the task in connection with what Marko just mentioned, to the 5-year sustainability plan. We also wanted to make a framework which makes the results sustainable. So as see, like 40% of people, so it's exactly 5 people, are confident that they can already implement the ETHNA system, but there are other people who might need help, and that's why we try to summarize the most important factors. So not just challenges, but also incentives and also good practices for different kinds of organizations. How could you go forward to implementing such an ethics governance system? Because the aim is of the ETHNA project is that we leave behind something that can be useful for the future, that can be useful for future institutions. So this is something that I would like to highlight to you in the next few minutes. Okay. And I think I will skip this because this we have been talking about. This is what I mentioned, that this evaluation was a long process. If somebody is interested in it, then you can go to the website, and also to the scientific articles that was published in the open source book, and you can read more about it. But just again, the main message is that these challenges that Maya and Marko and other presenters were already today telling to you, are coming from a really long way and really from a multi-stakeholder consultation process involving different kinds of actors in several European countries. Okay, so this is I think that where I can begin with this framework, which involves first of all 3 types of factors. So what we have been talking until right now, we categorized into 3 different types of factors, and this was made in another Horizon 2020 project, which was called RRI Practice, where Marko and, I don't know you personally, but ArcFund were involved, and I think they made a really useful RRI framework, which involves 3 factors. One are structural factors. So these are those factors, like you see, regulative and normative aspects that can have an impact on an organizational behavior in terms of how you can go forward with such an ethics governance structure and with RRI institutionalization. So these are the, so to say, the hard factors that are there within an organization, and there are cultural factors, which are the soft norms. So which are like organizational culture, values, identities that might benefit or might hinder the implementation of such a system like the ETHNA system. And the third factor is quite easily, it's called interchange-related factors. That are those factors that are not within an organization but outside of it. So you have the best intention to organize something, but maybe you don't get funding in your country, or maybe there is some policy that totally hinders the RRI. Like, I don't know, in Bulgaria or Hungary it can happen that they don't care about RRI and they are not financing it. So these are the 3 factors that we have. And these factors we were checking in all organizations, so all 6 of them that we were having. And these 6 organizations, which I know is an extremely small sample, but you have to take all the results that I'm going to present to you with a grain of salt. But this is a beginning, I think, that with which we can work. We put into 4 categories, 4 very simple categories, which are based on 2 factors. And these 2 factors are, one of them, the first one is one that we have been telling many times today, is leadership. So if you want to go forward with such a ethics governance structure, you need top-down support. What should come first? Marko also raised this question, is another one, top-down or bottom-up, but it should be there. And another one, which we call base, is the bottom-up part. So it might be that there are some organizations, which I will show it to you, that do not have explicit top-down support, but they have already some RRI support structures within the organization, even though they don't even think of it that it's RRI, like they have a gender equality plan, for example, or they are engaged in open access policies. So these were the 2 factors that we used, and it really made for a really simple categorization into 4 categories of organizations. So the best ones are, the best ones are here, where there's a strong leadership and a strong base, and there is one where there's a strong leadership, but there is nothing to build upon, and there can be interesting cases where there is no leadership, but there is something to build upon, so you have to find it, and somehow you have to go forward from bottom up, even if there is no top-down support. And the worst one, of course, is on the bottom left. This is the nothing exists, and this we agreed that it might be that you can implement it, but it's quite almost impossible. So we excluded these categories, so we will only deal with the other 4 categories. So if you don't have, if you have neither a leadership support nor base, how to build RRI, then it's really, the ETHNA system might not be useful for you. Okay. So this exercise has already been done by all implementers, so I'm really curious how you will now vote. So I try to explain it now as good as possible. So I would like to ask you again to go back to this slido.com. It's the same number, no? So it should come back, I think, this voting. And try just really quickly think through that your organization or your organizational department, where do you fit? So if you have a top-down support, you have a strong leadership who is interested in RRI, or you have already some structures that are available in the organization, or you have both in the best case, or you have nothing. That's the worst case. Okay. Okay, so it's 14 votes, and the first two categories have both a strong leadership. Okay, it's coming more now. Wait, okay. Okay. Yeah. Okay, so the first two categories have strong leadership, so it's, so to say, easier to achieve than having a base, which are there, and 24% have neither. So that are the categories that I said that it's where it's quite difficult to make the ETHNA system. Then you have to start from somewhere. So either you have to build up the base, or you have to get the support of the leadership. But I see that among, of course, our implementers and the guests, it's something where it's a starting position which is quite positive where you can start from. Okay, I will. No more votes. It's 17. It's okay. I will go forward. And in the next 3 slides, I will show it to you, and that's why I said to you that this is something that have been many times mentioned. Also, that when we talked already today with the implementers, this is just, so to say, a categorization to these 3 types of organizations and these 3 types of factors. Everything that you have given us. So it's based upon your input, what we have been discussing until now. It's just summarized in these 3 different categories of organizations with the aim to provide future implementers some support. So what I'm talking about, the first one are the best ones, sorry, about the strong base and strong leadership organizations. And we have self-evaluation, and it was Uhi and Harno who said that they are here. And you can see that here are the structural aspects, the cultural aspects, and these interchange aspects. And all in these 3 categories, we also check the drivers, the barriers, and the potential good practices. So what I'm talking about, let's see first maybe the drivers. So of course that we are talking about the best driver is always that there is strong institutional support. That's a structural aspect that comes from the institution, that you have a leadership that says that go forward with the RRI institutionalization. And in the best case, then you also get some resources, of course, with it. And this is coupled with a cultural aspect that the values are already aligned with RRI. So this we saw when we checked the documents and also talked with other people during the multi-stakeholder consultation, that this goes in hand, that if there is a leadership support, that usually also there's the organizational values that are also supportive of RRI. And what is interesting, so for example, a driver, it's always that if there is a leadership, that this organization wants to show that they are pioneers, they are front runners in RRI. So that also gives an external motivation, an external driver to go forward. But even in the best cases, there are of course challenges. I think this we have managed many times. This is again, Maya has it in a slide a few minutes ago. This is time constraint. Nobody has time because RRI is done in this culture of publish, of perish. Like Marko said, it's an 8-hour work every day. Nobody has time for it. And maybe you don't have a resource of it. Also, it can be that there is a lack of awareness or lack of understanding, even in the best organization, that what are RRI measures, RRI keys. And what can you do with it? So like Marko also mentioned, co-creation is very important. It's a participatory process. This is something that's a best practice that you should go forward with. And also, there are different kinds of formats of it, like open debate spaces, or you have to engage with external stakeholders. And for example, here, in the case of UHI, I think with the leadership of Ramon, they produced a code of good practices with a glossary, which I think was totally something useful, because you had a glossary which explained those terms that people were not understanding, because it was in this RRI jargon. And there you can go forward that people start to understand, oh, okay, this is what you are talking about when you are talking about, like, I don't know, open access or gender mainstreaming. Okay, going forward. So again, going forward, there were some cases where there's a strong leadership, so you have a get-go, but there is a weak base. And I put it here with red, that here the most problem is, of course, that there is a lack of time, a lack of human resources, a lack of funding. This you have to somehow get over in this case. It's okay that you got from the higher up get-go a positive answer, but still within your organization you have to find some ways how to really realistically implement the ethics governance system after the initial positive kickstart of it. Here, for example, what can be drivers? Okay, the management who gives the get-go. But for example, this was also interesting, organization facilitators. This can be people who are training the other people. This can be people who are explaining, for example, RRI terminology within an organizational department. And of course, there can be this we know that there can be contractual obligations or requirements from research funding organizations that can also speed up such a process. And what did we see? What were here the best practices? First of all, participatory approaches here first should focus on knowledge pooling. So you should understand what is already available within your organization and how you can build upon it. And this can be, for example, training sessions, or this can be like a website session explaining the, like I said, this jargon which is there. So this is something how you can get forward, because we saw that in the case of these organizations where there is a weak base, but there is a supportive leadership, the knowledge on RRI is fragmented. And last, the third type, which was for different reasons, I would say a strong base. So it existed already some RRI knowledge, like Marko said that they are involved in many RRI, 6 RRI related projects, but still the leadership was ambivalent. So I wouldn't call it per se weak, but it was still some problem. And this we also had by NTNU in a different way, that they had already lots of things to do with RRI, but still they weren't sure that with this ETHNA system and this ethics governance structure, they should go forward. In this case, the drivers can be these mandates and strategies and support structures, so the base, which is already there. Also, it can be, this we discussed also, it can be that why we want to go forward, because there is some external requirement from funding bodies. This is, for example, that you have to now do a gender equality plan in Horizon projects. That's also, of course, a very strong external incentive. And what you should do here, so what did we see, what are the best practices in this case? It's also, I'm repeating myself, but this is what we found. It's knowledge pooling within the organization and different co-creation measures that you should put into motion even without the leadership. So it's difficult, of course. So it can be done, for example, on departmental level, so not at the highest level of a bigger organization, or it can be done in some kind of an informal ways, for example, through reflection spaces. Sorry. So these are the 3 categories that we found, and if you are going to the website, it's the 4.3 deliverable, which is called Blueprint, and which is exactly just summarizing in this framework all these challenges and all these incentives that you have all been wonderfully explaining. This is what we thought, that it is something useful that can help for future implementers. They can think of it, oh, where is my institution? What can be feasible in my case? Okay, and this is my last slide. This is very much aligned with I think what we have already been discussing. So what I wanted to highlight one more time, that what we found out during our end of the very long evaluation and implementation process, that it's really important. It's not something groundbreaking, but it's really important that the approval and the support of the leadership is there to start such an implementation process. and the long-term impact, however, depends on the support structures. So it can be that you have the positive get-go, the positive answer from your management, but if there are no really advanced RRI basis in your institutions, in some ways, for example, open access or in gender equality, then it's really difficult to start. So this is this leadership and this is this base. That's why we said that these are the two most important factors at the beginning of the process. Yeah, and this is again, I know that it's not the most positive, not the most positive conclusion, but certain structural barriers will never disappear. So you won't have more time, maybe you won't have more money, you won't have more people. So somehow you have to find a way around this, circumvent it. And like we heard for example, with Louis, they focused on the junior researchers. So this is something that I think case by case you have to decide that how to go forward with it, because whenever you are reading the documents, these things always came back. So nobody can do this, of course, especially without any further additional funding. Okay, it's twice there, sorry about it. But feasible goals should be set, and I think this is the same like Marko said, so plan realistically. But I think that's the positive message here, even though there are these barriers here, an incremental approach, so going step by step, this we could see in the case of many implementers here, can lead to substantial changes. And then I hope that at 5 years' time, we will come back and once check it and say that, okay, this was the spark through ETHNA system that really led to some substantial changes in some organizations. Okay, and this positive note, we have like 10 more minutes. No? How many minutes do we have? 5? Okay, so I should give you back to you. Do we discuss this or? Back to 10 minutes. Okay. Okay, then I give 5 minutes to you, so I don't have to work. How would you start implementing? What would you focus on? How would you start implementing an ethics governance system if it was up to you? And then I think after Ramon will wrap it up the session. Thanks.
No. Sorry, I changed a bit the plans, but I think actually we only have 9 minutes left, so sorry, Gabor, for this. Maybe we can now use these 9 minutes just in case someone wants to ask something or to say something and to talk with our experts today. And we will have tomorrow more time as well, and this afternoon as well. So anyone that has any question or comments or reflection on the 3 presentations of this afternoon? Sorry, I made the first comment. Something that I think is quite interesting that we saw in the implementers before and now with these 3 interventions as well, with these 3 presentations, is actually we are learning that we are reaching the end of ETHNA, but not the end of the implementation. Actually, this is the beginning of the implementation, but that doesn't mean that we have not been doing a lot of things and achieving a lot of things. I think it's important to conclude as well with some optimistic message. I mean, many new code of good practices, committees, and now we are discovering that we need, as Marko was saying, Maya and Gabor as well, more time for improving the structure and then to working on the aspect of the culture, on not only changing structures, but changing the culture of research integrity, etc. So I think this is something common in the first presentations that we had before and now here as well. But are there any questions or comments from the public? I know we are looking forward for going to Benicassim, but Alberto.
Very fast. Just one more we are not addressing enough, in my opinion, because I think I have to advocate because that's what I usually do at work. I think we are not talking about the specific staff dedicated to implementing all these programs because, sorry, in my opinion, we need ethics committees but that's not enough. We need more. We need stuff that it's in all the process, taking all the submissions, proposing changes in the norms, in the policies, and all that. That's all.
Anyone that wants to say something? Well, Alberto is going to speak tomorrow as well on this. He is an RI officer from a university with a lot of expertise, so tomorrow we will listen from him more about this, but Gabor.
Okay. Maybe I didn't highlight it, but one of the best practices, and I think this came up also by Uninova and by other implementers, was this training that you have been organizing, and I think that's totally important. Also, I think by Uhi, sorry, I read all these documents, and I think if we were to make such a system, of course, that you have to train the people, so it was there in the slides, I just didn't point it out. I think that's really it's crucial, I think, to understand what RRI is and how would you start with it.
There is a bus waiting for us. Maybe Nikte, you want to say something about the organization plans, or Maria? Well, a big applause for...
Okay, so for the people that are coming to the activity in Benicàssim, we will have a bus at 4:15 in Hotel Jaime I, waiting for us to go to Benicàssim. So please be sharp at 4:15 in Hotel Jaime I. I can show you where it is. Here. Espera. 1 second, please. Because I have here a QR code, you can scan it, and you have the location of the hotel where the bus will stop to pick you all to go to Benicàssim. There we will have 2 activities, the guided part for the villas, and then a trip with Ramon. And we'll have dinner after that. So the bus will come back at 11 to Castelló, to the same place, to Hotel Jaime I. So you all know, you can go to the hotel and take some comfortable shoes, change if you want, and at 4:15 we leave, okay? So. Okay, and tomorrow we will start at 9 also, like today. See. So we can leave now, the bus will leave at 4:15, so we will not wait anyone that is later than that.
Gracias, María.
So this here in the quad, you have the location. If you want to scan it, or you, okay, you look for
Just
hotel.
tell me the name of the hotel again.
Hotel Jaime I,
Jaime I, okay.
like the university.
Okay, yeah.
It's actually...
It's 5 minutes.
Out, and then to the left, in the big road to the left, and it's there. It's like 3 minutes walk from